What if I told you we could take a force powerful enough to shatter solid rock, and instead of using it to destroy, we could use it to heal the human body? I know, it sounds like something straight out of sci-fi, but it's a real medical therapy with a fascinating and, well, literally explosive history. So, where do we even begin to unpack this? It all starts with a pretty wild question. What could bombs from World War II possibly have in common with modern medicine? The answer, believe it or not, is a shockwave. Okay, so the story actually kicks off back in the 1940s. Engineers noticed something really strange. Soldiers near underwater explosions were getting internal injuries, even with no visible wounds on the outside. Fast forward a few decades, and scientists in Germany figured out how to harness that same destructive power. In 1980, they used focused shockwaves for the very first time to obliterate a kidney stone inside a patient, totally avoiding surgery. But then, in 1988, things took a fascinating turn. They tried it on a bone fracture that just wouldn't heal. And that was the game-changing moment the technology pivoted from just smashing things to actually helping the body rebuild. And this brings us to this central puzzle, right? How can a force that breaks stones apart also trigger healing in our own delicate tissues, like tendons and bones? Well, the answer is all about the intention and the energy level. It really boils down to two totally different applications of the exact same technology. In urology, you have high-energy lithotripsy. You can think of this as a microscopic jackhammer designed to disintegrate kidney stones. But in orthopedics, they use a much lower-energy version called orthotripsy. And here, the goal isn't to smash anything at all. It's to stimulate or kind of wake up the body's own repair mechanisms. It's less like blasting the tissue and more like gently talking to it. So how exactly does the body respond when we talk to it like this? The key process has this big scientific-sounding name, neovascularization. But don't worry, it's actually a really simple and vital concept. It just means the creation of new blood vessels. See, when an injury becomes chronic, the blood flow to that area often gets really poor, and that stalls out the healing process completely. Shockwave therapy is designed to jumpstart that process all over again. Here's how that biological chain reaction actually works. First, the shockwaves are applied right to that injured spot. This causes a microscopic response, where the body starts releasing these crucial growth factors. These basically act like a signal flare, telling the body, hey, we need help over here. In response, tiny new blood vessels start to form, bringing in fresh blood, oxygen, and all the nutrients the area has been starved of. This flood of new resources is exactly what the body's stalled-out repair crew needs to finally get back to work and finish the job. Okay, so that's the theory, and it sounds great on paper. But you're probably thinking what I'm thinking. Does this actually work on real people with real injuries? What does the evidence say? Let's dive into the numbers from a major review, because they are pretty staggering. For those stubborn bone fractures that just refuse to heal on their own, look at that, an 88% success rate. For that nagging, painful plantar fasciitis, over 75% of people were totally complaint-free a year later. Even for painful calcium deposits in the shoulder, more than 60% found relief. I mean, these are just remarkable numbers for a treatment that doesn't involve a single incision. But wait a minute. Any good scientist or just a healthy skeptic is going to ask the big question. What about the placebo effect? How do we know it's not all just in people's heads? And that's a totally fair and crucial question. The best way to find out is with a randomized controlled trial, where one group gets the real deal and the other gets a fake treatment. Well, a 2008 study gives us a crystal clear answer. They looked at people with chronic Achilles tendinopathy. On the left, you've got the placebo group. And yeah, they did get a little better, about a 7-point improvement. But then, look at the shockwave group on the right, an 18-point jump. That is more than double the improvement. This shows a clear, significant benefit that goes way beyond the power of just believing you're getting better. Okay, so we've established that it works. The next logical thought is just crank up the power, right? More power means more healing. Makes sense. Well, it turns out the science is a lot more nuanced and kind of surprising. So this brings us to a really critical question. When you're trying to gently nudge a biological response, is more power really better? Is a sledgehammer better than a gentle tap? A recent study from 2024 put that exact idea to the test. Researchers set up a perfect head-to-head comparison. They looked at patients with that really annoying chronic tennis elbow. Group A got a low-energy dose of shockwaves. Group B got a high-energy dose, literally double the intensity. Everything else about the treatment was exactly the same. And the results were the complete opposite of what you'd probably guess. We're looking at pain scores here, so a lower number is what you want. After just 3 months, the low energy group was already reporting less pain. But check this out. At the 6-month mark, the difference is huge. The low energy group's pain score dropped all the way to 2.1, while the high energy group was stuck up at 3.2. The takeaway here is just wild. Less power actually led to more relief. The researchers themselves put it perfectly, saying low-energy ESWT was more effective and should be preferred in clinical practice. It shows it's not about hitting the tissue harder. It's about sending the right signal. It's a perfect Goldilocks effect. Not too much, not too little, just the right amount of energy to get the job done. So let's zoom out and put this all together. What's the bottom line here? Why does this technology matter so much for someone who's just, living with chronic pain? All right, so here are the big takeaways. First off, this is a powerful, non-invasive alternative for when surgery feels like the only option left. Second, it's not a Band-Aid that just masks the pain. It's a reboot for your body's own healing system. Third, the evidence is clear that it's super effective for a whole range of tough chronic problems. And finally, and maybe most fascinatingly, we've learned that when it comes to healing, finesse can be way more important than force. It's all about that perfect dose of energy. And that really brings us full circle, doesn't it? The journey of the shockwave, from an observation of wartime destruction to a tool for precise biological healing, is just an incredible story of human ingenuity. And it really makes you wonder, right? What other powerful forces are out there? Things we currently see as only destructive that are just waiting for us to understand them and repurpose them for healing.